Hi, all. Thanks so much for watching. Speaking of making healthcare work for you, I'm Stephanie Fields, and I am joined by my co-host, Dr. Apurv Gupta. And today we are talking about our interview with Dr. Phil Polakoff, and he is the founder and CEO of A Healthier We, and also a consulting professor at the Stanford University School of Medicine. There were so many really great takeaways from the interview with Phil. He was talking about the challenges of living in rural America. Everything from there being one licensed provider in what was the specialty, Apoorv?
It was psychiatry in Montana.
Psychiatry.
Yes.
One licensed psychiatrist in Montana, the whole state. And then he was talking about things needing innovation, using drones to get medication and delivering even blood work to different places. And that was just so mind blowing because you don't think about those types of things. You don't think, I live in Pittsburgh, you live in Rhode Island in a busy area, and neither of us have those access issues that some of these places may have. So to think that you need an appointment for something and there's one provider for your entire state is just, I can't get over how crazy that is, because that's a true access barrier in so many ways. You can't get to that one provider. That one provider certainly can't provide care to that many people in the whole state. That provider is certainly feeling burned out. It's just a compounding series of issues related to things like that. And those were the things that I never think of. When you think of rural healthcare, you think of treating chronic conditions, maybe not getting preventive care, but you don't think about those lack of providers, true lack of providers, hospital closings, and the need for technology to overcome those intense barriers. Apoorv, what did you think?
Yeah, Stephanie, I think you're right. He covered so many different areas and ultimately connected it everything to rural healthcare. So not only is it lack of access, lack of providers, lack of resources, there's the great divides that you see between rural and urban. He talked about broadband connections not being there in rural America, obviously poverty, the opioid crisis as well. So many different topics to cover. And you think, how are you going to make any dent in any of that? And yet he still was very optimistic and hopeful, as he's always been. I've known him as a great mentor and colleague over the course of my career. So he's focused on the key things that we can do. Make sure there's a personal element to the care, and don't just start thinking about yourself as a patient or even as a consumer. Be involved and think of yourself as a person. So I really like that. And probably his take home line, which is the relationship. So you're not going to solve any of these complex issues until you start figuring out how to connect better to each other, and ultimately figuring out how do we connect better to each other within a community within which we have to start solving some of these complex healthcare issues. So I love the gamut of things that Phil had to talk about, but I like how he brought it home and made it ultimately very personal and very relationship oriented.
He was very big on the we versus I. And going back to our interview with James Dold, he talked a lot about what sounded like the collaborative care model that James described.
hmm hmm You're right, Stephanie. And that's sort of where I think health and healthcare are coming to. They're realizing we have the same themes emerging across all of these complex challenges, which is the individual has to get involved. They have their voice has to be heard. None of this is going to get solved by other people. We all have to solve it. We all have to be involved. So it's the I and the we. We all have to jump in, raise our hands, make sure people understand what's working, what's not working. That's the only way that healthcare is ultimately going to move forward.
It has to be the people, not the processes, too. That was another thing that has struck me in so many of our recent interviews, that
Mhm.
everybody keeps saying it's not this system or that system. It's the fact that we have to work together. We have to talk and be a team.
Wonderfully said. I really agree. And when we're working in the system, those of us who are professionals in the system will fully recognize that. That's what we're trying to do as managers or entrepreneurs or consultants. Ultimately, we are all, learn that mantra. Hopefully, we understand and live by that mantra. There's nothing in healthcare, whether it's the most simple or the most complex, can get solved unless there's a group of people working together to try to challenge it.
Absolutely. Well, thank you all for watching, and stay tuned for the interview with Phil. We'll talk to you soon. Bye bye.
Bye bye.